Good afternoon, ladies and gentlemen, friends and patients. My name is Johannes van Waart. I'm an obstetrician and gynecologist in private practice and also the current president of the South African Society of Obstetricians and Gynecologists. This is a picture that you might not see in 3 to 4 years from now, as at the moment we have a huge big battle trying to fight off litigation against obstetricians. This because of the spiraling indemnity insurance. Indemnity insurance, you might ask, that's the insurance that we need to take out in order to make sure that patients that do have an adverse event actually get financially well covered, in those cases to look after them adequately in years to come. In our specific discipline of obstetricians, our indemnity insurance has gone up from 250,000 Rand a year in 2013 to 2017 rates of 850,000 Rand per year, which equates to 75,000 Rand per month that we need to pay in insurance. This while the medical aid funds only offer us 4,000 Rand per delivery, which in instance means that we do have to do 70 deliveries per month in order just to cover our costs. This while the nation average is 13 deliveries per month per obstetrician in a population of 550 private practice obstetricians. This certainly is not sustainable. And if you compare this 4,000 Rand that we get per delivery, you might just get a very good bicycle helmet for the same price with obviously different risks involved. In 2016, 50 to 80 of our colleagues left the discipline, and at the moment Worcester is without the services of a private obstetrician. Why then would this happen? Firstly, because the main cost driver is cerebral palsy. And cerebral palsy rate has not dropped down, even though we are doing more deliveries, and the reason then is because the quantum of the claims have actually gone up. Two reasons for that. Firstly, that there should be better care available for cerebral palsy children with technology and new medical treatment. And secondly, because of the lawyers that have actually depleted the funds of the road accident fund, they are now actually coming after doctors and obstetricians in particular. You have all heard the adverts on the television and on the radio. The scientific facts behind this is that cerebral palsy is only caused in less than 10% by intrapartum or delivery events, which means that more than 90% of those cases actually happens before delivery and totally unaware of. That means that if we do a delivery and there is a cerebral palsy patient being delivered without our knowledge, that we might interpret events during the delivery a little bit differently, and where sometimes a little change in the fetal heart pattern in a normal baby would not demand action, in a cerebral patient, this could actually not be the case. So what can we as obstetricians do to try and right this? Firstly, there are certain things that we can control and certain things that we cannot control. We can control our actions, and therefore we've instituted a program called the Better Obs program, where we try to standardize protocols throughout the country in the private hospitals, labor wards, to make sure that if a baby is delivered, that all actions are exactly the same under the same circumstances. We are also having every 2 months a meeting where we have the midwives, the pediatricians and all obstetricians involved in each hospital in order to learn from adverse events and also to learn from incidents that we call near misses, and this to improve our game. However, there are certain things that we cannot control, and those are fourfold. Firstly, we cannot control the law. Secondly, we cannot control the lawyers. Thirdly, we cannot control the indemnity insurance. And fourthly, we can partner up, but we cannot control patient behaviors. So what do we need? Firstly, we need some changes in the law. And here the Minister of Health, which has been very supportive of the fact, and also adding on to that, that the public sector is even bigger claim influenced at the moment, and almost a third of the health budget is under siege of litigation due to similar things that we go through in private practice. Now, to change the law, we need to cap claims. In other words, to ensure that patients that do have an adverse event are insured and covered adequately, but not excessively. Secondly, we need a certificate of merit for lawyers, where if lawyers do put in bogus claims against doctors and they lose them in court, that they are held responsible for the costs, which at the moment is not the case. Thirdly, the process of mediation should be looked after, and certainly we do believe that, like in the rest of the Western world, that litigation should only follow mediation. And about mediation, we know that more than 90% of medical adverse event cases are settled within 72 hours at approximately 5% of the cost, and successful in more than 90% of cases. We also need to educate the judicial system so that they understand the circumstances that we do operate in, and that sometimes it's not clear black and white, but we have sometimes to make decisions within seconds, and mostly we get them right, but not every time, because we are also human. We also have to partner up with the patients. We need to educate them, we need to inform them, and certainly we need to tell them that if an adverse event occurs, that the route of mediation should be the first port of call. We also must make the lawyers understand that what's happening at the moment is not to the advantage of our country in general, and certainly not to the mothers who are to be delivered. The question might then be asked, should we revert to the system where midwives and general practitioners deliver the babies? And certainly, I think it's a very good idea. But unfortunately, legally, a midwife and a general practitioner cannot do a delivery without the backup of an obstetrician, would then be there to save a life if a disaster occurs. What would happen now in 2 to 3 years if this situation continues and we would be paying in excess of 1 million rand a year for insurance? 140,000 deliveries will go to the state sector, which clearly will put an increased burden on an overloaded system already. Having the same number of doctors and doing 140,000 more deliveries per year will obviously increase claims against this, because more mistakes will be made. The patients going into those systems will have absolutely no choice and will have to deliver at the local clinics, just like the system works at the moment. And I think the most important of this is that more often and more likely there will be no young obstetricians and gynecologists to be trained, not even for the public sector, because this speciality of ours will certainly become unpopular and certainly would not attract good young talent. So you might ask then, why do I do this video? And certainly it is because we need your help. We need public awareness, and certainly we need you to understand as the public that if you get to your obstetrician, that the fees that they charge are not out of context, but there to survive and at least just to break even. Secondly, we need you as the public to put pressure on your medical aides to just tell them that you believe that your baby's life is worth more than a bicycle helmet. And thirdly, we would like you to ask the politicians you know for help to make sure that this system ensures fairness to all, not only to patients, but also to doctors, and certainly to those mothers and babies undelivered yet in this beautiful country of ours. Thank you very much, and we would appreciate your help to make private obstetrics in our country survive.